The coronavirus pandemic has taken a heavy toll on Florida's elderly residents. A staggering majority of the fatalities here are those 65 and older. And with an expansive network of assisted living facilities and nursing homes, the danger for seniors is serious. Like other states around the nation, Florida is turning to isolation centers for the elderly. The state now has more than 24 of them. They're designed to prevent the spread of COVID-19, give patients the attention they need, and free up space in the state's already strained hospitals.
These COVID nursing homes are places where a hospital could discharge safely a long-term care resident who's COVID positive. It also is a place where if there's infections inside a long-term care facility, the long-term care facility can send to the COVID-only facility.
In a state ravaged by the pandemic, the Bay Oaks retirement home in Miami is an exception. There have been no coronavirus cases here, but if any resident falls ill, staff say isolation is a good option.
I think it's a great idea. So if somebody has it, they should be in a place where they can be monitored by professionals who are experienced with whatever limited experience people have now with this terrible disease.
For the past 2 weeks in Florida, the number of new daily cases has hovered around 10,000. Miami has now mandated the wearing of masks. But in other parts of the state, those who can easily spread the virus are ignoring medical advice. The number of cases among those who work with the elderly has also risen sharply. But some experts say isolating elderly patients who contract COVID-19 may not be the best thing. One of the things not often talked about during this pandemic is the mental health aspect of living through these difficult times. Many elderly residents aren't allowed to see relatives. Social interaction is in many places not allowed, and moving those who are infected with COVID-19 may be detrimental to all involved. Those who specialize in geriatric care say isolation and patient transfers has its drawbacks.
Many residents are very confused by this situation, and with perhaps Alzheimer's or dementia may not understand fully what's going on and why are they no longer being visited every day by relatives.
Around 20% of Florida's population is over the age of 65. But even in communities like the Villages, where people are 55 and older, cases have quadrupled since the beginning of the month. While isolation units for those who fall ill are seen as a good strategy, risks remain for this state's older population, whether they live in care facilities or not. Andy Gallacher, Jazeera, Miami, Florida.